back from Caring Medical Center. I'm so happy to welcome back our next guest to the show. Once again, Dr. Timothy Special, a prolotherapist at Caring Medical Center and a patient of his, Beth Pritchard. Good morning. Welcome back.
Good morning.
Hi, Carly.
So the last time you were here, we were talking about your hip and how prolotherapy was able to help. And remind people, Doctor, what prolotherapy is. And we're going to be talking about the knee this morning.
Well, prolotherapy is regenerative medicine. It's a natural way to rebuild our ligaments and tendons and maybe possibly cartilages. This is a great thing to talk about because Elizabeth has had a hip problem with arthritis, and she's had markedly improved with platelet-rich plasma prolotherapy. But also, many people come in, they think it's their knee problem, which we're going to talk about right now, but there might be their hip that's just referring down to their knee. So they might, doctor, I've been having knee problems, I'm going to the knee doctor or whatever, and it's not their knee at all. It might be their hip. So we have to understand functional medicine. We have to understand referral patterns.
Yeah. So you brought a pretty cool machine this morning. We're going to do this live right on the air right now.
This is something that's been developed. People think of ultrasound, people having babies and stuff. Yeah. But the nice thing about this, it's musculoskeletal ultrasound. So it confirms what my diagnosis is without having any ionizing radiation. We can look at people's joints. So right here, we're going to take a look at Elizabeth. She's been kind enough. Now that, if you see that black space, okay, that's her. Well, the white area is her bone, okay, and the black area is the space, and we are actually looking at it. That is her knee joint. So if someone comes with arthritis, I can put calipers on and measure it, and it's like Elizabeth got better with her hip. We can actually measure how much better she is. So which is really a cool thing. No radiation right in the office, and then as well we can check for fluid, and we'll look right now to see if she does. It would be a black area. She doesn't have that. But if we go on the side here, and a lot of people have medial collateral ligament sprains and strains. Now, I showed you this earlier. That little triangle, if you want to show it right there, the triangle is her meniscus. That's her cartilage.
And this looks pretty good,
and
right?
she looks really good. And
good job, Beth.
And right above that is her here's her ligament. It's the medial collateral ligament. And I can actually stress this a little bit, and hers is good. But when someone is weak, you will see that. So this is a beautiful thing that we can actually inject our prolotherapy solutions to rebuild it, and you'll see it right in ultrasound. I would push things, and it guides the needle. So it's really much more specific. So this is a great tool that we have at Caring Medical. We've been using it for quite some time. It's another accent for us, as well as our physical examination, what we do. So basically what we're doing is rebuilding joints. The number one thing that we do, take care of our knees. And so it's a great tool. We can come in the office, we can look at it very, very quickly, be a little more specific with our injections.
Well, and a great thing you have coming up too, I know, where people can find out a little bit more. And again, you know, last time you were here, Beth, we were talking about the hip, we were talking about the knee this morning, but you can, you know, the neck, the, you know, elbows, I mean,
wrists,
it's
everything.
Anywhere where you have a joint, anywhere that somewhere, you know, bends,
if anything
essentially,
moves,
right?
there's a weak hinge. People get strains and sprains, and these are chronic things, and then they can lead to arthritis like Elizabeth has had, and we don't want to let that happen. We want to nip it in the bud.
So invite everybody out to this seminar that's going to be coming up in January that I know people are going to be very interested to learn more about.
Well, we're going to have an exciting seminar right by our office at Candlewood Suites. Dr. Hauser, myself, and Caring Medical. We like to teach, okay? As doctors, we're teachers, basically. So we want to instruct people, teach people, inform them about the benefits of prolotherapy for many, many patients, how it can help them for all types of the body, from the neck injuries, back, shoulders, ankles, and I think they'll really enjoy it.
Beth, would you encourage people? I know you were saying you're going to go out to this seminar. You want to even learn more, even though it's you know that it's helped you.
I am, and I've already been to one of the seminars and thoroughly enjoyed it and learned a lot. The doctors were very entertaining and very, very informative. And it's interesting to talk to other people who have issues and see how they're reacting. So it's a very worthwhile experience. I would recommend it.
So true. Well, if someone doesn't want to wait till January, they need to go ahead. They want to find out more today. What would you have them do? I know the website's a great place to start.
CaringMedical.com, and check it out. There's many, many injuries they can see. There's YouTube videos to helpful. And then call our staff. We've got a great staff, very informative, and they will help you and guide you.
They will. Thank you both so much for joining us this morning. We look forward to having you back. And